Good morning, all my East Coast friends. Uh, this is John Molinari talking with you from Central Coast, California, where we are not quite in quarantine, but we are not getting into large groups and getting out very much and doing things because we still have an increase in cases even in our rural county here in Central Coast. I'm speaking with you this morning to talk with you a little bit about the seminars that are going to be coming up on August 14th and 15th. For that, because we have a major pandemic that everybody is still wrestling with, and it's still spreading rather rapidly, the three topics that were chosen are emerging infectious diseases, infection control, of course, and vaccine updates. All three of these are important to you, and they are also important components of what will be discussed with regard to the SARS-CoV-2 and COVID-19 pandemic. I will be developing, and I have been developing, and will send to Concord handouts for your use, which will have most of the slides that I'll be talking about. In the emerging infectious disease section, I will be starting with a discussion on SARS-CoV-2 and COVID-19 pandemic information, giving you latest updates on the incidence, trends, what the virus is, what it isn't, how it infects, looking at transmission, looking at information as to medications, how we've improved in treating patients, lowering the death rate, which is still ungodly high. And looking at information that will allow us to understand as we see new developments. We'll be talking about other infectious diseases such as tuberculosis, hepatitis C, which are important diseases which remain with us. We sort of forget about these things. There will be a section comparing influenza and COVID-19. People still have some misconceptions about this. It's like looking at apples and oranges. The infection control section is going to be specifically altered because of some of the new recommendations and regulations that have come out since COVID regarding airborne transmission and airborne precautions. So in that section, in addition to your classic infection control pieces of information that you've probably heard at other places, and possibly from me, I will be including all of the information that OSHA has required about air quality improvement, personal protective equipment. We'll have a discussion on N95s, other types of respirators, differences between those and masks. We'll talk about some of the other components of infection control directly related to that aspect of it, but also looking at, of course, sterilization, disinfection, monitoring, dental water lines, so that you have a hopefully increased understanding where you need it in certain topics. The last section will be on vaccines. And in addition to discussing public health vaccines that are important to you as adults and healthcare workers, we'll be talking about some childhood vaccines, some of the issues that the pandemic has caused with a drop in about 50% of childhood vaccinations, which is very dangerous. But also in that section, I'm including a component about the development of the SARS-CoV-2 vaccine for COVID-19. There have been a number of developments. You've been reading about these in the news. My intent is to update you as much as possible, but also to give you information so that you can help discern where the information is going, what we need to know before we have a viable vaccine, and what kinds of checks and balances need to be developed and looked at before these things come out for the general population. At the end of the day, that's about, I forget how many hours, but it's a full day. Hopefully you'll still be with me, have many questions. I'll be happy to answer them. And I look forward to seeing you on those days. Thank you very much. We look forward to it. Bye.